All right, welcome everybody who is watching to Heartwood's newest webinar in our series. My name is Kara. I'm the program manager at Heartwood, and I'm pleased to have with us today Drea Pollard, who is the Education and Care Coordinator at the Sexual Assault and Intimate Partner Violence program at Health Sciences Center. So just a few things before we get started and hand it over. I'd like to start off with a land honoring. So with gratitude, humility, and respect, we recognize and honor that Heartwood Healing Center offices are located on the traditional territories of the Anishinaabe, Innu, and Oceti-Sakowin, and on the homeland of the Red River Métis. We recognize the historic and ongoing violence of colonization and the original intent and broken promises of the treaties, and we commit to working towards reconciliation. As a place for healing, we're committed to walking with those with whom we are privileged to work and understand that Indigenous peoples experience the impacts of colonization and oppressive systems of the past and present. We understand experiences of trauma as individual and collective, and we commit to learning and unlearning, to building alignment with TRC calls to action, the 2SMMIWG calls to justice, UNDRIP, and working towards decolonizing and anti-oppressive practice within our organization. Just a couple of little items before we get started. So Drea is going to be sharing with us about the program that she is working for at Health Sciences Center. And then we're going to have a little bit of time at the end for questions. I believe the Q&A feature is enabled for attendees to pop in any questions that you might have. And then we can get to those at the end. Attendees are completely anonymous, so if you're typing something in the Q&A, just worry not that nobody will know who is typing a question. And we welcome any and all questions that might come up during the presentation. So we'll have about 15 minutes for that at the end. And with that, I think I will hand it over to Drea.
Great, thank you, Kara. Hi, everyone. It's great to see you all here. As Kara mentioned, my name is Drea, and I am with the Sexual Assault Intimate Partner Violence Program at Health Sciences Center. I just want to start by giving a huge thank you to Heartwood Healing Center for welcoming me on behalf of our program, welcoming us and creating this space to share about the work that we do. We really appreciate the opportunity to connect with others doing such important trauma-informed work in our community and those who are wanting to learn more about that work as well. So I'm going to start sharing my screen here. Okay. Let me know if you can't see that, otherwise I'll just continue. So as I said, we're the hospital-based program for sexual assault and intimate partner violence program, and we are based in the Health Sciences Center. So some of the objectives that we're going to cover today, we just want to increase the knowledge and awareness of our program. It's otherwise known as a forensic nursing program here. We want to discuss the prevalence and risks of sexual violence and intimate partner violence. We want to develop an understanding of what is available for individuals who have experienced these things, and also just share an increased knowledge about the basic steps in providing care for these individuals, such as evidence collection, medical management, post-assault. So I do want to acknowledge that today's presentation includes discussion of topics related to sexual assault and intimate partner violence. These can be sensitive or triggering subjects, so please take care of yourselves in whatever way you need, so that if you need to step away for a moment or turn your camera off, or even afterwards, if this brings anything up, just feel free to reach out to a support if anything comes up for you. So to start a bit about who we are the first program in Canada, actually across nationwide, forensic program, started by two nurses around 1989. These two nurses had an interest in doing forensic exams. So in 2004, through private fundraising, a sexual assault suite was built, and this was to create a private, comforting space for patients, especially coming into hospital, to kind of get them out of that hectic environment. So this has served a great safe environment for patients. We now have a staff of 9 permanent staff and 4 casual forensic nurse examiners, and we work mainly in-house and then on call is overnight. So we're in-house 7:30 in the morning till 11:30 at night, and we're easily available that way, and then also available for phone calls and 24/7. So the nurses receive specialized training to care for victims of violence, and we do see over 800 patients every year. So we're just going to go into some definitions and then more into some understanding of what we do. So what is forensic nursing, you might ask? This is a type of nursing that provides care that bridges the healthcare and the legal system for victims of violence such as sexual assault, domestic violence, and child abuse. So forensic nurse is a registered or advanced practice nurse who's received specific education and training. They provide specialized care for patients who are experiencing acute and long-term health consequences associated with victimization or violence. Then we can meet the evidentiary needs related to being victimized or accused of victimization. So we also provide consultation and testimony for civil and criminal proceedings related to nursing practice, our care given, and then options regarding those findings. So forensic nursing care is not separate and distinct from other forms of medical care, but it's integrated into the overall care needs of individual patients. So we perform these medical forensic exams to collect evidence, provide medical treatment, provide support, holistic care, and in a trauma-informed, compassionate way to patients of all ages and genders, and connecting them with appropriate resources for follow-up care and justice if that is what they would like. What is sexual assault? So sexual assault is defined as any act of sexual contact on one person by another without mutual consent or with the inability of the individual to give consent. It can happen to anyone, any gender, any age. It may or may not include penetration, so any form of touching that is unwanted, and that is also a form of sexual assault. It is not about saying no, but it's about having the chance to say yes. And so this is a big thing that we talk about when we're educating, especially for just awareness. Is just a lot of teaching about consent. Sexual assault is a crime regardless of how many bruises or injuries, cuts or scrapes you can or cannot see. Regardless of that, it is a crime. When we go into intimate partner violence, we kind of use this term, but it does include teen dating violence, domestic violence. These are other terms that we use for this. And so this is when one person in a relationship tries to dominate and or control the other person through actual or threatened physical, sexual, psychological, emotional, or financial abuse. IPV can happen to people in all types of relationships. It can happen to people of any gender, race, culture, and age as well. And we do, for intimate partner violence, teen dating violence, it can be a current or ex, former partner, spouse, anyone that is in an intimate relationship with the person. So we kind of include all of those things in this. So we're going to take a little look at some of the stats, the prevalence, just a few of them here. There are a lot, but just to kind of touch on a few key things. 1 in 3 women and 1 in 8 men are subjected to unwanted sexual behavior. Indigenous women are 3 times more likely to be impacted by sexual violence. Manitoba and Saskatchewan have the highest rates of intimate partner violence in Canada, and only about 5% of people indicated that they reported their sexual assault to police. There aren't really statistics on specific statistics on who's accessing medical care, who's accessing other resources, but we are wanting to bring more awareness that it's not just police or nothing. There's a lot of different options that people have so that we can get them the support that they need, because as you can see, this is a very big problem. So some of the risks, risk factors, gender, finding that female or non-binary patients are at higher risk. The age range that we're seeing at higher risk is about 15 to 24. Relationship status, being single or unmarried, ethnicity or race, especially the Indigenous population having a higher risk, and folks with disabilities. In one study that was done, it showed that 83% of women and 32% of men with developmental disabilities have been sexually assaulted, which is a very high number. Some of the health consequences of gender-based violence that we're seeing, some of the long-term effects that can have increased cardiovascular disorders, increased metabolic disorders, increased risks of cancer, disturbances to sleep, increased mental health disorders, including PTSD, depression, anxiety, and suicide, increases in substance use, and there can also be assault-specific injuries. So whether that be soft tissue injuries, fractures, traumatic brain injuries, concussions, there are a lot of consequences of gender-based violence, whether it be a one-time event or an ongoing issue for some of these people in intimate partner relationships. So when we think about why people choose not to report, we want to kind of address the barriers as why, not necessarily why they're not reporting to police, but why they're not seeking help, why they're not disclosing to support systems. But specifically when it comes to police, there's sometimes a belief that police can't and won't do anything about it. So giving education about what the process is like and demystifying that a little bit is important. Sometimes people have had prior experience with police and the court system, and that is and can be really traumatic for some people. So that could be a reason why people choose not to report. There is also a very legitimate fear of the offender, especially if they live in their community, especially we're seeing in smaller communities. People are having that fear of reporting. There is also a fear of family or friends' perception, fear of their credibility being questioned, fear of not being believed. That's a really big one. Justice looks and means something different to them. So that's also another reason. So when people come to see us, we try to kind of discuss some of their barriers. But again, at the end of the day, we do what they want, and we don't really push on anyone to do anything, but we do like to discuss some of the barriers and some of the issues that they're facing, just so that they can have a really educated decision. So I'm just going to go into our program now. So who do we see? We see anyone that has experienced sexual assault, intimate partner violence, and this does include sexual exploitation, human trafficking, teen dating violence, all the things that we mentioned. We see patients from all over Manitoba, all genders. Our program specifically sees patients that are adolescents and adults, so we'll see anyone that is equal to the age of 14 and older. And then if there were anyone children 13 years of age and under, Health Sciences Center does have a CPC, which is the Child Protection Center, and we refer those children to them and they would take care of them. We will see anyone that has come in with acute or historical. So it doesn't really matter the timeline of when the violence has occurred. We will provide care, we'll provide advice and direction and resources and holistic care to these survivors. So if someone is wanting to access forensic nursing services, this has also been previously known as SANE, so Sexual Assault Nurse Examiner. We're kind of broadening the term to forensic nursing just because it does encompass more than just the sexual assault. It can include the intimate partner violence and other areas as well. So you'll those are interchangeable, but forensic nursing services. So if someone is in Winnipeg and they wanted to access our services, they can just attend Health Sciences Center adult or children's emergency. That would be based on their age. They can also call our forensic nurses. We are available 24/7. And then there's also community forensic nurses available as well, and some of our community agencies, which I'll go over at the end. So they can call anytime and we can kind of help direct. We can help give them options over the phone. We can let them know what things it might look like. Based on time of day, they might have other options of locations for where they would want to go. But One important thing to know is that when they do come to Health Sciences Center, because we have in-house staff, they are not having to wait the same wait times as other patients coming into the emergency department. So if there's a forensic nurse available, it's our goal and our mandate to see patients within 20 minutes of their arrival at triage. The exception to this would be if there was like a medical concern for the patient, or if our forensic nurse is already with another patient, then we would communicate that there might be a bit of a wait, but otherwise we are seeing them within 20 minutes during kind of the 7:30 a.m. to 11:30 p.m. time frame, and overnight, since we're on call, we have an hour to present to the hospital to see the patient. So you won't have to wait those like 10 to 12 hour wait times, which is sometimes nice to know when people are coming. If people are coming from outside of Winnipeg, there are some healthcare facilities throughout the province that do have forensic nurses. We've been training some nurses in Thompson, Selkirk, Brandon, Steinbach, and Winkler Morden area. So again, people can call us and we can kind of connect depending on if they have availability that day or not. And then we also would accept a patient from anywhere in Manitoba if they want to leave their community to come get seen by our program, or if there's not availability in their community. And at any point in time, people from all around the province can just call us for advice. So once someone presents to the hospital, what happens? As I said, they have to present through children's or adult emergency. They do have to present to triage. We do like to say that they don't necessarily have to tell their stories, tell what happened when they get there. All they have to do is say, I'm here to see the forensic nurse. We really want to decrease the amount of times that people have to tell their story. So there might be a couple screening questions that they have to answer just to make sure there's no medical concerns that might need intervention immediately, but otherwise they can just ask for the forensic nurse and then we will come and see them. If there is a private waiting area available, the triage nurses will escort them to that area just so that it feels more safe and quiet. And then that's where the forensic nurse will come and meet the patient. So we meet privately with everybody. We have a one-on-one conversation. We review all of the options. Just kind of hear a little bit about what happened and just let them know that they're in control from that moment onward. There's no pressure to do anything, and we really just want to do what they want, but we want them to make that informed decision, so we present them with all of the options. We offer them a support person. We work closely with the Clinic Sexual Assault Crisis Program, and so they have advocates that are available to come and be with people at hospital, so we can call them and they can come support them through the process. We review the options, and then if they choose to have involvement with our team, if they want any type of exam, then we bring them to a private suite in the hospital. So these are some pictures of what our suite looks like. And so there's the entrance sitting area there. Once you get into this space, it's very quiet, it's very private, it's secure, it's not labeled, so people don't really know what is kind of behind the door. So there's the exam room. We do have a police room and a soft interview room. So if someone is choosing to have police involvement, they do have the opportunity to make a statement in the suite without having to go to headquarters. They can just have all of that done. And again, that's up to them. And then we have a lot of resources that we provide as well. People are able to bring family and friends to come with them to the suite, any support that they want. We want them to feel supported, and we have spiritual care, we have Indigenous services. So if they're also wanting someone from our program to come and be with them, that is an option as well. We like to talk about consent because informed consent must be given prior to an examination. The patient has the right to refuse an exam, even if they're an adolescent. So anyone 14 and up that we see, as long as they understand what their options are and they're able to make that informed decision, it is up to them. They don't need a parent or guardian to sign for on behalf of them. And also, if they were to come with a a caregiver that wants the exam done for them, but the patient does not want that done, then we go by what the patient says and what they want. So a medical forensic exam cannot be done if the patient is under the influence of drugs or alcohol. So sometimes we just have that conversation that we just have to wait a little bit. A medical forensic exam cannot be done without a substitute decision maker in certain cases. So sometimes in the event if there is a patient that comes in that's unconscious, or if there's any developmental diagnoses or mental health issues that they're not able to make their own decisions, then we involve substitute decision makers, but then we also always put first what the patient is wanting and however they're able to communicate that. Consent for medical treatment does not cover the collection of forensic evidence, so we do have to do a separate consent process for that. And that's just because if they are choosing to have that done, it may go to court, and we have to be able to prove that they had the ability and capacity to consent, that they understood all of their options and made that choice for themselves. So the age of consent for sexual activity is 16 years old. So we kind of talk about this in the sense that when we are seeing patients that are under 18, there are some mandatory reports that we have to make. So anyone under 18, we would have to report to CFS, just the incidents of violence, of sexual assault or teen dating violence. And then we keep in mind these laws as well. So there's some, so anyone under 16, there's some close in age exceptions. So we kind of go by if a 14, 15-year-old, they may consent to sexual activity with a peer who's less than 5 years older than them and not in a position of trust or authority. So if a 14-year-old came in and reported a sexual assault with someone that was over 5 years older than them, then that would be a mandatory report. Typically, CFS will make those reports once they're made known, but these are just some things to keep in mind that we might inquire if the age of the assailant is known or not, and we have to follow the mandatory reporting for these. So getting into what is a medical forensic exam, I've kind of been using those words a lot, but now we'll go into what that means so you can understand. So when I talk about giving patients their options, we really enforce that they are in control. So when someone presents after a sexual assault, we typically give them 3 kind of main options, and they can choose within those options what they want and what they don't want. So the first option is medical only, and so the priority is always somebody's health, physical, mental, spiritual, emotional well-being. And so the medical only, that would mean no police involvement. We can provide any of these options for them: a head-to-toe assessment, suicide assessment, focused assessment if there's been like a strangulation or head injury. We can provide testing and prophylaxis for sexually transmitted infections, and we can provide medications like HIV, PEP, pregnancy prevention, vaccinations, HBIG, which is a post-exposure prophylaxis for hepatitis B, any of those medications that they would want to take to prevent infections. We can provide documentation of injury. We provide resources, discharge planning, safety planning is required, and then the mandatory reports that I had talked about. We cannot confirm if they've been sexually assaulted, and this is kind of in the case if someone came in with like a loss of memory, loss of consciousness. We provide a very objective assessment so there are times, well, we're not going to be able to tell them exactly if they're wanting answers like, did this happen, did this not happen to me? But we can kind of give them support and education and help them through that process. The other option is a forensic exam. And so this is when we would offer everything listed on the medical side, but then we would also collect forensic evidence specimens. So this might include body swabs for DNA, if there was any thoughts or potential if there was any drug or alcohol facilitated sexual assault. So if drugs or alcohol were either given to them without consent or used as an opportunity for that sexual assault, then we would take that as evidence. We would do genital swabs. We also can take clothing, foreign objects. There's forensic photography as well, so pictures of injuries, and then use of an ALS, which is an alternate light source. It's that blue light that shines, and it can show substances on the body. And we would swab those areas as well. And again, if there's any part of these exams that patients are uncomfortable with, then we won't do it. But then this would be for the purposes of those samples going to law enforcement to help with the investigation. The third option is called a forensic hold, and this is if someone is unsure if they want to report to police or not, and they're maybe thinking about it, they're not really sure what to do, we can do the medical exam, we can collect all the same evidence, and it's just kind of held. The police do not start an investigation until that person is wanting to come forward and make that report. And so it's just held in the law enforcement facility, and they can come and make that report, whether it be in a week or 10 years, 20 years. It is held indefinitely. So then there's kind of relieves that pressure of like making that decision if they're unsure. This is not an option with IPV cases, and we'll get to that after. There is another option if they do not want police involvement necessarily, but they do still want to engage, or they don't want to engage with the justice system, but they want to make a report anonymously. So this can facilitate sometimes with the healing process and remains a welcoming option to help victims feel empowered and in control of what happens next. They go to a third-party agency and they can get assisted to making an anonymous report. They would take down the details. The details would go to law enforcement, but not any of their personal information. So it's police can use this information to track trends or patterns that could identify repeat offenders, and it could also just be a way of someone having that as a process of their healing. So there are a few places in Winnipeg that people can make third-party reports to, and then outside of Winnipeg as well, it can be done over the phone or in the northeastern Manitoba at the Survivors Hope Crisis Center. So that is another option as well. So intimate partner violence options, there are only two options with this just because of the mandates for the police, for law enforcement. So there's the medical only. If they do not want police involved, we can still do everything, documentation of injury and safety planning, provide resources, and then we can also offer them that forensic exam where everything would go towards the investigation for police. The reason that we cannot do a hold in this situation is because in the hold situations, we do still have to give over the evidence to police and they hold it without investigating. But on the side of law enforcement, they have a mandate that if they are aware of a domestic violence situation, they have a mandate to investigate. So if they were to collect that hold evidence, then they're made aware and they have a mandate to investigate. So it kind of just negates the hold option for them. But one thing that we do say is, like, if people do not want police involvement at this point, but are thinking maybe potentially in the future or are not sure, we can do that medical. We still do very thorough injury documentation. We take photos and that's stored on their medical file. And at any point in the future, that medical file can be subpoenaed, and then all of that would be there as well. One thing to note for IPV is that if there are any children that witness any IPV violence or are living as a main residence in a home where IPV is occurring, that is a mandatory report for us to make to CFS. And I know that sometimes that can sound scary to people involving CFS, but it really, based on the CFS Act, that it is a mandate for us to, in order to protect the children, and it doesn't necessarily mean that the children are going to be taken away from the home, but they are mandated to just do an investigation, and that is to be able to provide support to the person who's experienced the violence and the children to make sure that they're safe. So after the examinations, we do recommend follow-up for all the patients that we see. So medical follow-up in 2 weeks. Then again, they should have some repeat blood work, just because that the tests that we take initially are kind of like a baseline. If they were exposed to anything, we do want them to get that that testing ongoing at this 4 to 6 weeks, 3 months, and 6 months, just to ensure their health. We always phone all of our patients, if with their consent, of course, after they come to visit us, just to kind of do a check-in, give them all the results that we have received from the tests, and then answer any questions they might have about the exam, assess how they've tolerated any medications they might have taken, and review resources that we've given, and if they need help connecting to any of those longer-term counseling resources, we can help them with that as well. Discharge and then other resources that we can provide. So interpreters are available at our program site. We can offer spiritual care, indigenous care. We can connect them to victim services. So there's a lot of resources that they can provide. The victim services is only available to those who have made a report, so that they have an incident number, or those who have made a third-party report. We can connect them to psychotherapy. There's a lot of community agencies that we work with that we like to connect our patients with, and we do like to do that on an individual basis. We kind of assess their needs and kind of see what organization might be the best fit, and if we can get some referrals done, we do that as well. If they are open to social work involvement for some safe discharge planning, sometimes with our patients after IPV, they maybe need to go to a shelter or need some additional resources. We can help them with that as well, and then connecting them with the follow-up piece. Providing trauma-informed care is always our priority, so we do like to decrease the number of times someone is asked to retell their story, or re-ask the same question. So if we need to consult anyone else from the multidisciplinary team, we try to have those discussions together so that they do not have to repeat what they've said. We adapt our exam and our language to fit the situation. So depending on what they've gone through, how much information is being given to them, and how and when we explain things. So we're really, really watching the words that we use, continually assessing how they're tolerating everything, and kind of letting them lead the exam. Giving our patients choices, not only initially, but throughout the exam, having them participate as much as they would like to, and just making sure that they feel safe and feel in control. And if the patient isn't in the place to make a decision, there are other options. So they can always come back. They can always go to one of the community sites if that is more appropriate for them, if that's what they choose. And so we can discuss that as well. And then we sometimes would let them know that if they are considering reporting to police or medical forensic exams, some of the things that they might want to keep in mind as far as keeping that evidence preserved. So how do I respond when someone has been assaulted? So you might come across someone in your work, in your community, in your family, friend circle, and sometimes we're not sure how to respond when someone discloses. And so we want to remember that everyone's response and reaction is different. There's no inappropriate response. We will see people that are tearful, and sometimes we will see people who are giggling and laughing, but just understanding the trauma response, and that can come with a variety of responses, and just kind of letting them be able to feel safe in however they're reacting. We're leaving our judgment at the door. We're always being self-aware of how we are presenting, how we're speaking, our body language is. Knowing and understanding the long-term effects, believing them, that's a huge one. Giving the control back to them. The more that you educate yourself about options and resources, and then the more we can give control back to them by having them have educated decisions. We want to reassure them that it's not their fault. This is a big one, that people sometimes, because of culture or stigmas, think that because of situations or personal decisions that it might have been their fault, but that is never true. Their sexual assault is never the victim's fault. And so that needs to be reinforced often. We want to normalize their feelings. We want to provide privacy, offer supports, and then direct to the appropriate care and resources. So just wanted to talk about the two other community sites that provide forensic nurses. So Hummingbird, and so the Hummingbird program is based out of Clinic. And so at Hummingbird, you also will have access to forensic nurses, cultural support, advocates, and system navigation. The advocates can come to Health Sciences Center, and they also are available at Clinic. They help people communicate their needs. They can also provide more information and help about the choices and connecting with resources. And so they have their hours there. They're open Monday to Saturday. And then there also is a crisis line available 24 hours. And the nurse line, they would be available as well. And then there's another program based out of Gunny-Kinichik, the Sexual Wellness Lodge. And so their program is called Walking with Our Relatives. And this supports relatives of all genders who have experienced sexual assault and or intimate partner violence as well. And so they provide those confidential forensic exams, support from the aunties, system navigators, and or CUCUMs, and also access to counseling from Indigenous social workers. So we work closely with Clinic and Gunny-Kinichik to really meet the patient's needs wherever they're at, depending on where they feel comfortable going, what the time of day is. If there's any medical concerns, we kind of take those 24-hour, we kind of do the 24-hour calls, the triage, and kind of ask the patient what they would like, where they would want to go, and refer and get them there appropriately. Okay, so thank you. That's, I think I'll open it up to questions now if there's anything. And this is just some contact information. So 24/7, you can call our forensic nurse examiners and through paging. So that's at HSC paging. You just have to ask for the forensic nurse and they'll direct you right to the cell phone of the forensic nurse. And then this is my information here, my office phone and my work cell phone. If you have any questions, I am available. And then also my email address. So I'm going to stop sharing this and then I'll see if there's any questions here.
Awesome. Thanks so much, Drea. That was really great to hear all that information and just kind of know what's available to folks out in the community. Because, yeah, people might not know what's available to them if they've had an experience that would benefit from support like that. So that's really awesome. Maybe we'll let folks type their questions in the chat for a minute. I see we have a couple in there. But I had a question that maybe we could start out with. I was wondering, depending on what option folks choose for the type of care they receive, what's like the average length of time that somebody would spend with one of the staff members doing, for example, the medical option or the hold or...
Right. Yeah. So if someone would just want like the medical option, just like blood work and medications, probably expect to be in between like around an hour. Just because we have to send off the blood work, we want to get those results before offering the medications so that we just make sure that everyone can tolerate that, reviewing with the doctor. If there are more extensive injuries and they need a more like thorough head to toe exam, then I would say maybe 2 to 3 hours. And then if the forensic component, again, it could be done within like 2 to 3 hours. adding kind of another hour if the police are going to come and do the interview there. Um, but then again, I will say that we have seen some people come in that have had quite extensive injuries. And if the patient is choosing to have all of that documented, then it could be upwards of like 5 to 6 hours. So when we initially meet the patient, we kind of get a general idea and we can give them a little bit of an idea, but sometimes it can be quite long. Yeah, and then we just like to provide them with the supports that they need, food, drinks. We provide new clothes after the exam. There's a shower as well afterwards, but yeah, it can be quite extensive.
For sure. And if, say, for example, the nurse conducting the exam determines that maybe like a CT scan or X-rays would be warranted, do they have the ability to go and order that right away and have it done right away?
We have a really great relationship with the emergency room physicians. So sometimes if someone presents to triage and there has been history of like strangulation or head injury, we would go and we would talk to the patient, see what their need, what they would like, and then we can sometimes, I won't say always, because it depends on the emergency department busyness, but as a whole, I do believe that the department like understands that people coming after this type of trauma, it's not appropriate for them to just be sitting in the waiting room forever. And sometimes that does need to happen, but often if we're there and we can advocate, like then we can get that CT signed off on or like an X-ray done quickly. And then, so I will say that's what we advocate for. And sometimes it happens, and sometimes just with the logistics, it's unable to happen. But then we can provide an advocate in the waiting room with them, or we can see what we can have done before then so that their stay is not as long as it needs to be. But in those cases, it's probably like the best place for them to be if they need that care anyways. But yeah, or the waits,
Yeah.
unfortunately, sometimes.
Yeah, for sure. That's good to know, though. And, just given the fact that, depending on what option folks choose for their care, how extensive maybe the injuries or experiences were that they had, they
Mhm,
could be there for quite some time, kind of just
mhm,
getting through the process. So,
yeah,
is it allowed for folks to bring like their own support person with them, like a family or friend to sit with them during that time?
absolutely. Yeah. And they can have more than one. Yeah.
Okay.
There's not like a number restriction. Yeah. So, and they can come with them back to that suite in that area. And then they kind of also have their own little area to sit. And absolutely.
Great. Yeah, that could definitely make it a bit easier for folks, I would imagine, to have, yeah, like a comfortable, familiar person. So that's
Hmm.
good to know. Maybe we'll just move over to the chat because I see we have a few questions. Somebody's asking what the difference is between the soft interview room and the police room.
Okay, yeah. So the soft interview room would be kind of where the survivor would kind of sit in. It's like with the area with the couches, and there's a fridge and a coffee maker we have, and that room has like microphones and video cameras that are only turned on if there's an interview, not always. And then the police room is where we store our evidence, and then there's a computer, and that's where the police kind of do the recording of the interview. And it's just like a secure locked room that only a few people have access to, so then that evidence is secure in there as well.
Awesome. So say if somebody requests police involvement, do they typically respond pretty quickly to
They
those requests?
do, yeah. So there's our specific units within WPS that um, so there's the sex crimes unit and the domestic violence unit, and they are open 7 days a week. Around office hours. And so if it's during those times, we call them directly and see if they're available to do that. Um, if it's after hours, it does kind of depend on the situation sometimes, but then we would report to general patrol and then they would kind of make that call out and kind of get an idea. But so it does sometimes depend on the time of day. But as much as they can accommodate that, they do like to do that. Mhm.
Okay. That's great to know also. I think maybe the next question or comment kind of speaks to what you were talking about with regards to barriers for folks reporting or coming
Mhm.
forward to get support. So, yeah, I'm wondering what you would tell somebody who says that they're worried about coming forward because they're afraid they won't be believed
Mhm.
due to like the circumstances. So like what is something that you would tell them in order to get them the supports?
I think knowing the right places to go where there are like just knowing that there are people that will believe you, like if you come here, know that you will be believed. If you go to clinic, know that you will be believed. And so I think that it might even be a good idea to call like that 24/7 crisis line and talk to like an advocate. Like you can get connected with an advocate without presenting to hospital or clinic. You can call them and you can get that support before you would even come. And so that might be something that you could look into is as kind of having someone, by your side even in that first step. So like that is available to you. So you don't have to come here alone. You don't have to present somewhere else alone. You don't have to go to the police alone. You don't have to go to the courts alone. The advocates will come to get a protection order with you. They will come to do a statement with you to police, and they will really advocate for you in what you're saying and what you're speaking to. And if you have any concerns, fears, questions about the law enforcement or justice system, they can speak on behalf of you with your permission, obviously. So you can maybe have those discussions with them beforehand if that's something that you're like, I really want to, but I'm scared. You can get that support in place before you take those steps. And so just know that that's available and you don't have to be alone. There are people that do and will believe you, and there are people that want to stand with you through this and help you through the process of healing and whatever that looks like for you and whatever process that is.
100%. Yeah, that's really important to know. So at Heartwood, we work with folks aged 16 or older who have experiences of childhood sexual abuse. So folks in their mid to late teen years and into adulthood who have had like past experiences of sexual abuse, whereas you folks deal with individuals who have had sometimes acute experiences of sexual assault or maybe historical. Do you find like how often would you say that like you're encountering somebody who, due to the like current experience of maybe sexual violence they've had, it's maybe brought up other things
Mm.
from their past that are now becoming a challenge to that are making life challenging for them.
Yeah, I would say it's not uncommon. Like it's quite frequently that we'll be, talking with a survivor and then it'll bring up something from the past. And oftentimes the one in the past is the one that hasn't been like they didn't receive care at that point in time. And like now that there's more awareness and education and availability of resources, both of them are kind of so they're dealing with an acute and a historical traumatic event. And so yeah, it is. It's unfortunate how common that is, and so I think it's important for our team to kind of know how triggering that is, and to really put that thought and care into that, and then also know the resources like yourself. Like it's not just providing that follow-up care for this particular event, but also for that previous one as well, because that um, years of dealing with that trauma and like not talking about it is yeah we talked about the damage that can do so mhm,
Yeah, for sure. And if you're working with somebody who has had, say, an experience of childhood sexual abuse in the past,
mhm,
how would you go about supporting that? Because, there might not be like physical evidence to collect documentation of, but is it more
right.
around like resourcing or?
Yeah, so and it also kind of depends if they've ever depending on the type of violence, like if it was sexual versus physical, if they've ever had any kind of like STBBI testing, treat things like that. So the medical portion of it, but also we work really closely with the Child Protection Center. And so they have because I know sometimes like the programming, there can be quite the wait list for some of the
Mhm.
places that we like to refer people to. But in the meantime, and also with CPC, they provide a trauma focused CBT therapy. So we can in the like kind of get connected with them, and then they can also provide follow-up and that assessment, that intake to kind of help bridge some of those gaps. Um, and that, but yeah, it's more on that side. It would be like the emotional and mental well-being, getting those kind of things in place and making those referrals. Yeah.
For sure. Another question just came up in the chat asking if somebody would still have to do all the examination even though the assailant has been out of their life for some time.
No. So that, yeah, the medical exam and like the forensic evidence collection, like the forensic evidence collection, there is like a time frame. It's usually around 10 days. So if something has happened before that, if there's still injury, if there's still pain, things like that, then we would do an assessment like that. But if it's more like beyond that, it's more historical and like there's not any like visible injuries, we wouldn't have to do that thorough exam. It would be more that kind of holistic approach, making sure there's not any long-term consequences, and then getting the connections to all of the things that you would decide to be involved in.
For sure.
Yeah.
Yeah, makes sense. Someone in the chat also just noting that there's no statute of limitations on sexual abuse reports in Manitoba. So I think we can just confirm that that is true. So that's the reason why third-party reporting exists, why folks are able to make reports for historical instances of sexual assault, because no matter when it has happened to somebody, you can report that whether through third-party reporting or police reporting at any time and get support for it at any time. So yeah, just reiterating that is absolutely true.
Mm-hmm.
Okay. I'm not seeing any more questions in the chat. Yeah, I'll maybe just like give it a couple more seconds for anybody to type in any questions. But yeah, are there any closing thoughts or comments on your end, Drea?
No, I appreciate you all being here, and hopefully this information was helpful. If there's anything, if you ever have any questions that come up later on, you have my contact information there. And yeah, I just hope that this has provided some help and some direction. If it's something that you have experienced or are experiencing, that you can feel supported and know that there are options, and we can help you find some of those things to help heal.
Yeah, amazing. Thanks so much for being here. We really appreciate you sharing your time and your knowledge with us. And it was really great to just learn more about the resources available in the community. So thank you so much, everybody, for joining us. And we will see you at our next webinar, we hope.
Thank you.